will grow, no question. People will come back closer together. And Europe has to be able to maintain, like other countries and other regions, some very important principles. I think we've all established globally that we wish collectively to protect older and vulnerable individuals with a high risk of death if they contract this disease. I think we've all seen the devastating impact of this disease in those vulnerable groups. I think the second thing we've all come to a consensus around is that our schools are important and the education of our children is something that we hold above all else. How do we hold those two principles? Protecting the vulnerable from death, getting our children back to school. Something, in some sense, has to give, because we have to sustain pressure on this virus. We have to reduce transmission at community level in order to lower the risk to those older and vulnerable people and to maintain an environment in which our children can continue to attend school. The only way to do that is that the adults separate themselves enough to drive transmission downwards. So what is more important, our children back at school or the nightclubs and the bars open? And I think these are decisions that we have to make in coming into the winter months. These are trade-offs. There are no easy answers, and it would be very easy to sit here with Dr. Tedros and say you can do this and this and this and this. Unfortunately, sometimes when you do this, you can't do the other thing. You have to make those decisions. So I do think there's a time for decision-making coming as the season grows into the winter months for many, many countries. And there are no correct answers, and I think the risk management approach is the only way to go. We have to, if we're going to keep our kids at school and if we're going to protect those older and vulnerable people, and we don't as yet have a vaccine, then sustain surveillance, test and trace, quick results, cluster investigation, isolation of cases, quarantining of contacts. I'm sorry to be boring and I'm sorry to keep saying this over and over and over again, but there are no alternatives. This is what we must do. And the DG has said it again and again and again. I know it's not easy and it's hard to sustain and everyone is exhausted. But if we are to serve our children and those older and vulnerable people in our population who might die this winter in these countries, then we must sustain these other activities. And these cannot be sustained without government commitment to do this and society's commitment to participate and be part of this. And I do think that conversation needs to be had in many countries right now. And it's something that needs to be, there are no magic bullets, I've said it before, and we need to stop looking for unicorns.
Thank you, Dr. Ryan. Now I'm inviting Nicolas Luco from Santiago, Chile, to ask his question. Nicolas, can you hear me?
And I can hear you.
Thank you. Go ahead.
I would like to ask Executive Director of UNICEF the following question. COVID has disrupted much, but what disruptions would you mention as positive? For example, the greater involvement of fathers in the bringing up of children, or new ways of learning, or new ways of leveraging health in school systems. Thank you.
Thank you for this very interesting question. Executive Director 4.
This is a wonderful observation. There are more fathers involved now in parenting and in being a teacher than we have had in many, many decades. And it is because they are home and they are seeing what their children are learning and what happens in the home when they've often been away or outside of the home at work. We often tell our own people that they need to be a parent first, a teacher second, and then a colleague at UNICEF third. And I think this is starting to be something that almost every one of us in our own private lives have now realized, that the importance of looking after our children and teaching them many things while they are in school and when they are out of school is our responsibility, and it's our legacy to the next generation. We are also finding that parenting hubs, these chat rooms and telephone banks where parents can ask information of websites and others are extremely helpful. And many fathers are coming to visit, but also fathers and mothers together because they are interested or they're concerned about a particular issue. It's particularly challenging for parents who have children who are otherwise abled. And so if there is some sort of a learning disability, it is difficult often for parents to know what to do. So parenting hubs and information has really become primary, and we are seeing lots and lots of parents that are coming for information, and that is enormously good. It's powerful. So how will we come out of this time of COVID stronger? We believe that we can have a leapfrog of technologies and of the ability to have remote learning. We've recently launched with some private sector partners, Microsoft and the University of Cambridge, something called the Learning Passport, which allows a country to put its national education system online and for young people to download it in their own home language. It was originally developed for refugees who were on the move and unable to reach their national curriculum. But now we are seeing that there is a great use for this in countries all over the world. So Timor-Leste said they would sign up right away and try to get learning to their students so that they would not miss any schooling. But it is a time for all of us to relook at the investments that we are placing in education. If we can connect every school and every learner to the internet in the next 5 or 6 years, we will have moved our world a leap forward. So we have an initiative that is all UN agencies. It is a big public-private partnership in which we are talking about how to connect every school and learner to the internet. Many children now are interested in learning things, but they do not necessarily want to learn what they had been learning in the classroom. And now that the classroom isn't there, they want to learn things that they think will be relevant. So initiated learning is also good. It's part of learning for a lifetime. So online, remote learning, this is our once in a generation opportunity to really get this in place for the entire world. It's developed countries as well as developing countries. We've all found that there is not enough connectivity and we are not ready in our school curriculums for online learning. So we work with UNESCO often on this around the world and with WHO on many of these issues. Thank you very much.
Thank you, Executive Director, for these inspiring words. I will now give the floor to Gabriela Sotomayor from Proceso, Mexican journalist. Gabriela, can you hear me?
Sí, yes.
Oh.
Hello.
My question is, I will make it in Spanish. Maybe Mike Ryan already answered part of the question, but I will ask it anyways. Parece que...
It would seem that for some governments, it's easier to depend on education over the radio or the television rather than make every single effort possible to ensure that children can go back to school. In spite of the fact that in some countries there continues to be an increase in cases, there are regions which aren't quite as much affected by the virus. And I heard that there were creative measures that could be taken, and my question is, are governments avoiding their obligations to guarantee the right to education in a way? And where is the right balance to be struck? Because children need to go back to school, to play and to be together, and parents need to go back to work.
Thank you, Gabriela. Dr. Ryan will start. Mike?
Yeah, no, frankly, I don't think there's a single person on this planet that doesn't want our kids back in school. I mean, that's the place for our children. The difficulty is putting our kids back in school in a safe environment that's safe for them, for their teachers, for the community. And there are so many unknowns with this virus that it's understandable that everyone is taking very cautious steps, very tentative steps to do this. We take one step forward, we learn some more, then we move forward some more. And then sometimes we move forward and we have to step back because we learn something, we need to do it a different way. And I think if we accept that process, that we are all in this together and everyone wants that to happen, then we can look at the individual context in individual countries and at subnational level. I think Henrietta has laid it out. Different countries are at different stages of being able to deliver their education products remotely versus non-remotely. And when you have a very strong remote learning platform, you can choose to use that more quickly and take your kids out of physical school. But where you have a situation where that's not developed, then keeping kids at school becomes a priority. And you may have to leave your children in school even though you do have more community transmission. And these are trade-offs, and they have to be managed according to the risks and the how society sees and values that process for within the national context. So it's very hard for WHO or UNICEF or UNESCO to pre-specify how countries make those decisions. I do think that the evidence that is emerging is that children, while obviously they can be infected, they tend to process the infection quickly, they tend to clear the infection quickly, and they do not appear to be a major part of the transmission dynamics of this pandemic. But that remains to be fully discovered. What we do know is that children are damaged educationally by not being in school. And then we're trading those two things off against each other. The other question is, how safe can the school environment be made? And there are different resources around the world. There's different levels of space. If you live in an urban slum, you may have a very tiny classroom with 50 children in it. That's very different to having 20 kids in a gymnasium in a school that has access to more and more space and then can expand. So again, it comes down to the ability of the system to adapt to the risk. And some systems can adapt because they have the resources and the space and they have the planning, and some not the case. So I think it's very hard to pre-specify. But I would like to commend on one thing I think we should say is that teachers and administrators around the world have really worked themselves so hard to bring kids back to school, and that is from the village level to the national level. There are huge efforts made by teachers, parents groups, by committees and others who govern schools to get our kids back to school. And we spoke about the heroes in the first 5 or 6 months of this epidemic, and they still remain heroes, our frontline health workers. Well, our teachers and our school administrators and our school committees, they're heroes too, because they're doing everything they can to get our children back to school. And governments need to support them in that, and we as a community need to support them in that. And the best thing we can do to support our children back in school is reduce our risk of being exposed and reduce our chance of exposing others. If we do that, our children can stay in school. And again, I'm saying it again because I think it comes down to that. What are we prepared to do in the adult community to ensure that we neither expose ourselves or expose others to this virus? If we do that, I think we can keep our kids in school. Yeah.
Very briefly, just to say, I think what we're seeing right now is it's a calibration period. You know, we're really figuring this out of how we can do this. How can we look at controlling transmission within the community and dust entertainment industries, our school, and the agony, quite frankly, that decision makers have on when they can open up and how they can open up. And I know all over the world, people who run the schools, the administrators, are agonizing over how to do this social well-being of children, for their mental health, for safety, for security, and in many parts of the world, where children receive their meal for the day. So it's incredibly important. And remote working, and there is remote learning has definitely been a positive, but that doesn't exist all over the world. And any parent who has had to try to carry on their work at home and try to teach a child or 2 or 3 who are home with them knows how difficult it is. We all have collectively an incredible increased respect for teachers and what they do every single day. Within the guidance that we have outlined, what we are trying to do has been highlighted by many today and previously with our partners from UNESCO and with UNICEF is really try to give an overview of the comprehensive, multi-layered measures that are needed to prevent the introduction of the virus into a school, and if the virus does enter the school, how to prevent it from spreading. And this includes what to do in communities, at the school itself, within the classroom itself, and at individual levels. And all of this starts at home. It starts at what can we do at home to prevent ourselves from getting infected, to protect our families. And what is positive with children is that you can make this fun. You know, children and teaching them and being a good role model at home and showing them how to wash your hands and sing the songs and practice your respiratory etiquette, wear a mask, you know, practice your physical distancing, talk about it. This is very, very difficult stuff. Each other and support each other. And I think that, you know, we are finding ways to get through this. But, you know, just to say this calibration balance that we are finding, putting our children first and making sure that they can go back to school safely, everybody agrees, is incredibly important.
Thank you, Maria. I believe UNESCO and UNICEF guest would like to say a few words. Let's start with Stefania Giannini from UNESCO.
Thank you very much for giving the floor. Just to say that from the very beginning of this unprecedented crisis and the impact, the huge impact on education, continuity of learning has been somehow our red line, our claim, and all what we are doing and we did together over the last 6 months was about really assuring as much as possible continuity of learning to children. And this is very much about implementing the right to education that the journalist who put the question mentioned before. Of course, as international organization, we must be very honest. We don't have binding measures. We cannot impose a decision. It's not our job. But it's about, first, providing quick solutions. Second, organizing a strong and very innovative kind of partnership. I mentioned the Global Coalition that UNESCO established some months ago, and this is about putting teachers as one of the flagship of the common action. And teacher means supporting them in their lack of training in digital classrooms. Our survey, recent survey, says that 65% of globally teachers we asked, are you prepared to jump from the traditional classroom to the virtual ones? They said no. And then that's the need to support the governments to train teachers and to make the system resilient and ready to go, we don't know, in a second wave or whatever, in a crisis which imposes politicians to shut down their school systems. But now the issue is another one. The issue is how we can provide political leaders the right tools to make the right choices and to make decisions in terms of reopening schools in a safe manner and to give right education today in the new environment. I already mentioned some of the very concrete recommendations. Rita first, before talk about the physical the distancing and hygiene measures, washing hands. I want to say there is a very concrete recommendation about educating the young, the very little children to wear correctly the mask. Now, for us, it's clear that it's like this, but if you put like this, it doesn't work. Just to give you a very concrete example of what you're doing. And then there is the next phase. Let me say very, very briefly, in my opinion, this COVID-19 in education has been really, in education as well as in many other public sectors, a big game changer. So it reduced the distance, already said before, between family space, family time, teaching and learning space and time. It's about giving children and teachers also the opportunity to find very innovative solutions and to governments to implement a different kind of approach. Radio, television, we saw many very, very interesting countries in many regions of the world, sub-Saharan region in Africa first. So to conclude, I think that it's also a great opportunity to reimagine education, the model of learning and teaching. And this is something that UNESCO started to think with our partners last year, and now the futures of education, as he said, with the mark of S, is becoming really a great priority for all of us, and a new way to give right education to our youth and children. Over.
Thank you. Now I would like to give the floor to Executive Director 4.
Thank you. You can see how passionate we all are about this. So Gabriella asked about governments, and Mike Ryan started with the heroes that we have among us, the teachers and the health workers, and Maria picked that up, and Stefania just mentioned it. Governments can be heroes if they invest in schools. This is the time when they should do it. So rearranging budgets so that there is some room for education will mean that it's an investment for the future. It's the best investment you can make, to invest in a child and a young person. So invest in the teachers, invest in a modern curriculum, invest in the physical distancing and the ability to wash your hands and have a bar of soap, as we talked about for Africa, and invest in connectivity. If governments reallocate their budgets around connecting every school to the internet and training the teachers and training everyone, they will have a new baseline, a new even field that means that their children and their country can grow in the years ahead. So governments can be heroes too. Thank you.
Thank you. Thank you, Dr. Tedros, Executive Director 4, Director General Azulay, and Stefania for your all valuable contribution. I now will conclude this press conference and remind you that we will provide you with the audio file and Dr. Tedros' remarks immediately after this press conference. We will also have the full transcript posted tomorrow on our website. I apologize to those who could not get their questions answered. Please contact me, contact the WHO news team, and we will make sure you get your answers from us or our sister agencies. Thank you so much. Au revoir. Dr. Tedros, if you want to say a few words before we conclude.
I think you said au revoir, so I will say à bientôt. So thank you so much to Henrietta, Stefania, for joining us. This is a very important joint venture, and long live our partnership, UNESCO, UNICEF, and WHO, and look forward to really implementing the guidance that we have released today together. So thank you so much, and especially to Henrietta, I would like to recognize the presence of Jerome with us, your excellent colleague here. He has been embedded with us for more than 6 months, and impressed by his commitment. But what do I expect from UNICEF? Of course, I'm not surprised. So thank you so much indeed. This is the kind of partnership we need to really uphold. And it's only together that we can defeat this pandemic. Again, thank you so much.
Very good. Thank you, Tedros. Thank you, Stefania.
Thank you. Thank you. Bye. Bye-bye. Thank you very much.